It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, and welcome back to this episode of Back to the Basics. I appreciate you guys joining me today for this episode. I am super excited about this episode. We are going to talk about brain health today, which I know a lot of you ask a ton of questions. And so I'm super excited to get started with Dr. Joshua Daniel. So he is a distinguished neurologist with over 18 years of clinical experience, specializing in brain health, cognitive function, and peak performance. He's a strong advocate for preventative care, emphasizing its role in reducing disease incidence and enhancing overall health outcomes. Driven by a passion for exceptional patient care, Dr. Daniel is dedicated to optimizing the health and wellness of high performers. Determined to transform traditional medical practices, Dr. Daniel challenges the conventional approach of waiting for symptoms before taking action. His commitment lies in proactively improving patient health, providing the necessary care and support to foster healthier, more productive lives. Dr. Daniel seeks to make a meaningful impact by guiding patients to innovative solutions for their general and neurologic health, underscoring the importance of prioritizing brain health as the most valuable asset. You can connect with him on Instagram, and I'll have all that information in the show note. He has some awesome Instagram posts. I follow him, so you guys should all follow him. But thank you for joining me, Dr. Daniel.
Thanks for that beautiful introduction. Super excited to be here today. My biggest role, I believe, has been educating. I think we can do so much, and you've done such a great platform. You have the podcast and Instagram. You can reach out to so many more patients this way. So thanks for the introduction for sure, and super excited about sharing knowledge and helping as many people as we can.
Yeah. Yes. And brain health is a huge topic that, people are asking about. It's so important. I liked how you said, you work towards preventing issues. So you don't want to wait till people actually have symptoms, but more of a prevention approach, which is my whole thing in medicine. Like, we need to be trying to prevent a lot of stuff. And, I give a lecture once a month to physicians. I help educate people, but I do a topic on brain health. And I start all of it by saying, everyone in here has a brain, right? And it doesn't matter if you get cancer or if you get diabetes or if you get thyroid disease. None of that matters if your brain doesn't work, right? So our brain is one of the most important organ systems that we have because it allows us to do all the things that we want to do. So I'm so excited to ask you a bunch of questions. But do you want to give everyone like a brief background of maybe like how you got in this or what you do every day?
Yeah.
Like, what is it like to be Dr. Daniel?
So I was born and raised in Philly, and then I trained internationally. I did a year in England as well, which was a really cool healthcare system to see the differences in different countries. And I trained in North Jersey, then Central Jersey. So I was always in the Northeast and afterwards. And eventually I was an attending in South Jersey, where I was the chief of neurology, director of the Stroke and Dementia Center. And for me, I think the option or the yearning for prevention started when I would see so many people that were young or old with cognitive issues, stroke, brain tumors. I still do telehealth rounds in Florida and Jersey, but I've seen patients that are 20 years old who have stage 4 cancer or primary cancer of their brain, even stroke or aneurysm or bleeding. So, unfortunately, age doesn't stop diseases from occurring. But I was thinking that why am I such in a reactive background where, I'm looking at patients once they have the symptoms, but if I could go step back a few years and really prevent them by various vitamins, nutrient supplements, things that we can do years earlier, really prevent the onset of pathology occurring years down the line. So what you do now will really take effect into things that will happen later on. And I would say even cognitive impairment, that's a big topic, but I would say 40 to 50, even up to 70% of it many times can be preventative if we do the right things early enough. And that's why action is so important for me.
So you're saying that's awesome. Wow. 50%, up to 50% of our brain issues could be prevented if we did something proactively.
For sure, especially in the age or in the area of cognitive impairment. That's the big thing as we have an older generation that's having extended lifespan. if we change things early enough, their risk of having cognitive impairment and dementia goes down significantly. Simple fact of people that were deficient in vitamin D. If you can correct that level alone, I think it decreases 20 to 30% of your risk of having cognitive impairment. Just one simple thing. We talk about social isolation. Patients that were more isolated, it was a risk factor of like smoking 15 cigarettes. It's as equivalent as a risk factor. So if I can educate my patients about these small changes, the benefits down the line are huge. So it's just small changes that we can do now that for me has been a new passion of mine.
Yeah, and that's big with me too. And that's why I started this, this podcast, Back to the Basics. What are the little things that we can do to be healthier? And I agree with that wholeheartedly. Like I see a ton of people who have vitamin deficiencies. And my big thing is insulin, right? So insulin is one of the most, it is the most inflammatory molecule, I think, in our body. And so, diet, we'll get to that. But there are so many things you can do to help prevent this mild cognitive, incline and issues with dementia over time. And so it's just educating people. You said vitamin D. I love that. Because the World Health Organization says a normal level is 30 because they're idiots.
Correct.
They don't read literature. But, so yes, I love that you're talking about these little things we can do. And up to 50% of the time, we can help people keep their brain healthy, which is amazing. So
I think we're in a society of over-information as well. I think with social media, sometimes patients just get plummeted with information, and it's really sticking back to the basics, right? I have patients who ask me, well, what's the best diet? It's really simple, wholesome, common sense things. Everybody is on a fad these days, whether it's Atkins, paleo, keto, South Beach, whatever it is, carnivore. There's always a fad occurring. But if you stick to the basics, like you said, I think the benefit lies there.
Yep. I couldn't agree more. I've tried every diet there is on the planet. Right now I'm on the intuitive eating whole food diet, which is just, I know everything that I pick up and put in my mouth. I know all the ingredients. I can tell you what they are. I try to prioritize protein. I eat fiber. I eat until I'm full. I try to eat 30 different foods a day. That's it. That's the diet that I follow, which
And
is
no crazy food labels, right? No gums, no chemicals.
no.
You shouldn't be reading fancy labels.
Yeah, nope. I know everything that I put in my mouth. So if you can't tell me, and I did a podcast last week that just came out today that we were talking about this. If you can't tell me everything that's in your food, you probably shouldn't be eating it. Pretty easy.
100%. It's basics.
Yeah, very basic. Very basic. Okay, so what are some of the testing so let's say I'm developing some memory issues. What's some of the testing that you would recommend somebody have if they feel like they have memory issues? Because I know a lot of people come to me and say, well, I talked to my primary care doctor and they said I'm just getting older, or, they just checked my thyroid and it was fine and my vitamin D is, 32, I'm fine. What are some basic things that you would recommend people get tested for if they're having memory issues?
For sure. I think starting off with a great history is the most important thing when the symptoms started. And not only having the patient there, but also ideally a family member, because many times patients don't even know they have issues cognitively. And it's really the family member who provides more history. And it's not the patient's fault, they just might not know it. So it starts with a really detailed history and a physical exam. And for me, physical exam could be looking for other things such as Parkinson's. Do they have a second thing on top of just the cognitive impairment? I like to go over their past medical history, other risk factors they may have, whether it's diabetes, hypertension, sleep apnea is a big one that's many times not asked, and it's such a big risk for heart disease and stroke, and other medications they've been on, right? So benzos, benzodiazepine, Valium, Ativan increases the risk of cognitive impairment. And even going through their medication list, because there's studies that show that if patients are on 5 or 6 more medications, their risk of having cognitive impairment goes up significantly. It's almost like 50 to 60% higher. There's a correlation between multiple medications. So I want to see what meds they are on. Do they know why they're on it? Because many times these patients are on medications, they don't even know why they're on it and if there's interactions, right? So we want to rule out things. I think great memory testing, whether it's a neurocognitive evaluation, which is a formal 2 to 3 hour test, going through which aspects of memory is being affected, to something basic like the mini mental state exam. So I did a test the other day on social media where naming animals, four-legged animals over 1 minute. And if you scored a certain level, your risk of cognitive impairment could be higher to drawing a simple clock. And then obviously there's images on top of that. I always love to image patients, especially with an MRI. I think CAT scans are great, but there's a risk of radiation and the detail's not there, whereas the MRI is beneficial because I want to rule out other things like a history of stroke, right, that patients might not know about, whether they have a brain tumor. So for me, an MRI gives a detailed picture of looking at the brain, structurally for sure, and seeing if there's any atrophy or shrinkage in certain parts of the brain and why it's there. So it's not one thing. I would say it's multiple things back to back. But the most important fact is to get checked early, because once the symptoms start coming out, it can progress pretty rapidly in some patients. And in other patients, it may be slower, but time is of the essence.
So what I hear you saying is you take more of a holistic approach to this, right? So you're looking at
Definitely.
everything. You're looking at medications, you're looking at history, and you want to do it early. And so I like that point as well. You would not believe, well, you probably would, the number of women and men who come to me on gabapentin, pain medication, something to help them sleep like trazodone and an SSRI, like that combo is
It's
pretty
terrible. It's
routine.
terrible
And then
combo.
they're like, I have brain fog. And I'm like, no kidding.
Yeah, anybody
Yeah,
would.
you do. And they're like, I wake up in the morning and I'm like, yeah, because you have all these drugs you take to sleep, I mean, and so it's just, yeah. So medications, I think that's a really good point. And just,
I
are
can
there
relate.
certain, go ahead.
I've taken gabapentin maybe, I would say 15 years ago. I ended up having back surgery, and I was like, let me try one of these because he gave me an entire bottle of it. And people take 3,600 milligrams, up to
A
3,600
day.
milligrams a day. I took 300 milligrams and I could not function the next morning. It was terrible. And I have people that I've seen walking around on dosing 12 times higher than mine.
Yeah. Yep. Me too. And then they don't understand why they are foggy headed the next day. So what about vitamins? Like, are there certain vitamins you check? Like, I'm really a big passion about D and B and folate. I think if there was an easier way we could check omega levels in blood, I know there is a way, but I mean, what are your, thyroid, iodine? Do you have certain vitamins that you check after you do this detailed history and look at their medications? Because I think that is number one. That's the first thing I do is look at medicines, like what medicine can we get you off of? Because I agree, the more medicines you're on, the more side effects you have, the more issues.
So blood for sure, because many times people will have symptoms of cognitive impairment or memory loss, and it's really a vitamin deficiency. So like you nailed on the head with the vitamin D, omegas, but I also want to see their hormone levels, especially for men and females, whether it's testosterone, estrogen, progesterone, because sometimes it might be just the hormone imbalance that's causing to have brain fog, which for them may be early cognitive impairment. So hormones are critical out of all that. I definitely like the blood sugar, like you said, inflammatory marker, uh, correlation with insulin, but I want to see their 3 month blood sugar for sure, A1C, glucose, insulin, because if I can control some of the biggest risk factors they have, people do notice an improvement afterward.
I completely agree. And a lot of people don't even realize they feel bad, right? So I reviewed labs yesterday. Sunday's my lab review day. I reviewed about 40 people's labs. I do fasting insulin and glucose on everyone. I like uric acid. I like CRPs just to see, some inflammatory markers. But the point to that was out of 40 people that I reviewed labs on yesterday, 32 of them had fasting glucose levels above 100. That's a
Oh,
problem.
wow. That's a
Yeah.
big issue. For me, I start
Yeah.
to panic if I see anything more than 10. Like I want to just definitely get that controlled much to an optimal level. So 100's a lot.
So I said glucose, fasting
Oh,
glucose.
glucose. I think you said insulin. I
Glucose.
was like, insulin, that's
No,
really high
no,
for insulin.
insulin. Yeah, no, I like insulin below 5. And
Correct.
I saw a 20 yesterday. I saw a 32. I saw a 27. And yeah, it's like you can't expect these people to have good mental function because they're so inflamed. So yeah, I like that. And I do think that there's some disconnect in what we learn and what's actually real. Like our B12 levels, right, on lab reference ranges say that a
Correct.
B12 of 280 is normal. Are you kidding me? Nobody feels well
No,
with the B12 of
800 to
280.
1200 is perfect. And most people will ask,
Yes.
like, even if it's higher, if that's an issue. And I'm like, no, it's water soluble. You end up urinating it out. And The way I describe
Yes.
the body is, and the brain, it's like a complex machine, right? It's a very complex machine that needs everything to be optimized at all times. So, those reference ranges are just for average. My patients need to be above average. So we want certain things higher that are normal and certain things that are lower that are abnormal.
I really like that. I'm going to steal that. I'm going to steal that from you. Dr. Daniel would like his patients to be above average. Modern endocrine would like their patients to be above
Yeah.
average too. We want you to be optimal. And then I like that you pointed out the sex hormones. I'm a big advocate in hormones. We are missing the nail in this country on hormones. Unfortunately, after the WHI in 2001, everyone got scared of hormones. And we have basically in the last 23 years put a lot of people in really bad places because we ripped their hormones away from them. And then we have all these doctors, unfortunately, and providers who have terrible information and just have not educated themselves about this, how you can do hormones safely. There is a safe way, there is an unsafe way. But they help with so many things. And one of the things I tell my patients is they help with blood flow to your brain. And guess what? The more blood flow you have your brain, the better off your brain's going to be, and your
Definitely.
heart and everything else. So I do think that we do a huge disservice in this country when it comes to hormones. But I do think that that's changing too. It's just going to take some time and some
But
education.
it's slow. That's the problem. Whatever providers are practicing now, it's something from 20, 30 years ago. Even when you graduate med school, whatever you've been taught then is kind of become outdated. So to become cutting edge and really to provide for your patients, physicians always need to be learning, attending conferences. I think there's so much out there that we can add that's basic, that's not a pharmaceutical. That's the other problem, that we don't really get much time in the traditional healthcare system with the patients, right? We have 10 to 15 minutes. That's all. And how can you do a cognitive assessment, or how can you see a patient at all with their symptoms, a potential natural treatment plan, and following up with them in 10 to 15 minutes? It doesn't exist. So I think the whole system needs to change, because this is going to be a long-term problem where we're just treating disease and pathology. We really become an environment of sick care, right? You go to your doc and they ask you what's wrong. Well, no, I just want to go there to make sure everything is well. I don't have anything wrong with me.
I completely agree. So I'm working on a new building right now. It's almost done. I'm excited, but I really want to focus on preventative and wellness care. So I'm going to have a lot of things we can do to just keep you well. And I completely agree. You're either going to spend money on your health, you're going to spend an exorbitant amount of money in your 60s, 70s, and 80s when you're not well, or you can spend a little bit throughout your lifetime and stay well. And that's what I want to do. And I read a statistic. I don't know if this is what you feel, but right now they're saying that at least half of people at the age of 80 have pretty significant cognitive impairment in this country. Half, which is,
Even earlier, for
yeah,
sure.
yeah. And I read something where a lot of people in their 30s and 40s have mild cognitive impairment now at this point, 30 to 40, which I'm almost 40. And so it's like, that's insane. And I want to live to be 80, 90. I want to live as long as I can, as long as I'm mentally okay and I can and do what I want. And so to know that half the people in this country at 80, aren't mentally there is nuts. And to think about there are people in their 30s and 40s who have these issues, and I see it too. I don't know if you see it, but like I see people who come to me with significant depression and anxiety and issues. And I'm like, God, we got to fix your gut. We got to fix your hormones. We got to fix your micronutrients. And guess what? They actually feel better. It's like, wow.
No, think about it. How
um,
many how many neurologists or psychiatrists do a gut health? And they
None.
really don't. Or how many psychiatrists take a look at the brain when they're dealing with medications that deal with the brain? But it's sad. Back to your point with the 30, 40-year-old, one of the earliest patients, or the most memorable patients that really was disturbing to see, was I had a 45-year-old who I knew was a cognitive impairment patient. I thought that it must have been something else. And this was when I was in Jersey. And the husband led the wife into the room. I tried to talk to her, but she didn't respond back. There was no eye contact. And when I asked him questions, it seems that over the past year, she total lost verbal ability. She couldn't talk anymore. She did not have any understanding capacity. He had to cook for her, feed her, because she didn't remember how to eat. She wouldn't know if she ate or drank, to the point where a 45-year-old is wearing diapers. And I was so taken back by that I took a year for such a drastic change, that I even sent her to Penn, who was our main sister hospital, and at a dementia center. And their response was, well, there was nothing else they could do, because she was so past that point I was even trying to get her into any clinical trial I could that time because I felt so bad for the family. And that was it. It was one of the most terrible, I guess it was the most terrible case that I've ever seen in a 45-year-old who lost total verbal capability and no ability to do any activities of daily living. It was definitely very, very sad.
So were you able to do like a big workup on her and see like, was it her gut? Was it her, or was this prior to you doing more of a
She was
functional approach?
so far down the line that even when we scanned her, her brain had like shrunk up more than 60% of normal volume,
It's
which
crazy.
was insane. And back in the
Yeah.
traditional healthcare system, no insurance would ever allow any of the workup that we can do now, right? Basic even blood testing, they only allow basic blood tests. And if you want to order something advanced, well, the initial stage has to be abnormal for the next stage to come through.
Yeah.
And it could take almost a year to get the workup done with approvals, auths, denials, and reauthorizations.
Yeah. And
It's
it's
sad.
sad because you can do a lot of it for, I can do a lot of micronutrient testing. I can even do some genetic testing, do a lot of it for probably $1,000 or less.
Exactly.
And it's
Exactly.
like
And if it was done
this.
earlier,
Yeah. Yes. So I have some more things to go back and talk to you about as far as diet goes. I have so many things I want to talk to you about, but diet. So here's some of the things people talk to me about. So tell me about seed oils. Are all seed oils bad? Can we have seed oils? Can you have them before they're cooked? Like, what is your take on seed oils? Is it killing us
I,
or?
I hate seed oils. It can last up to your body for almost 2 years. I think it causes a lot of inflammation. And the reason is because we're not supposed to have them. For me, the best thing that I do to cook in any type of oil is I always cook in coconut oil and I always add olive oil to my food afterward. And it has to be first press, cold press, single source, organic olive oil. My diet's boring. I eat the same things over and over every day. It's like a regimen. One day a week or once every 2 weeks, I'll go out and eat. But for me, it's been such a meticulous thing where I do the same things and it becomes just a part of me. But back to your question, no, I hate seed oils. I don't think we should have any seed oils. Think about if you see when the seed oils were really introduced, all the diseases that came afterward. And I think it's a lot to do with inflammation. Our body doesn't recognize it, doesn't process it.
So if somebody doesn't know what is a seed oil, what would you tell them?
Something probably you're using. Canola oil, vegetable oil, the most commonest oils nearly all the restaurants use. Um,
So, So
after,
Crisco and any of the just oils that we use, as long as if it's not olive oil or coconut oil, we shouldn't be using it.
correct. I think I do like avocado oil because it has a higher smoke point. Whereas if you cook with olive oil, it denatures it because it has a lower smoke point. But for me, it's always been coconut oil to cook in, add olive oil after I cook.
Yes, correct. I did know that. So no putting olive oil on your food prior to cooking it. What about, have you heard of the butters that are made out of like tallow? So like tallow
I do
butter.
like those. I
Okay.
do use that
That's
as
what
a
I use
backup.
to cook in. Okay, great. So we cook in tallow oil or like tallow butter, and then I use olive oil
Correct.
on my food, but no other oils for Dr.
No.
Daniel. Okay. What
And
about,
all the restaurants have it, which is crazy. You cannot even
well,
ask them to cook it in anything else. Every single food is usually in most restaurants is cooked in seed oil.
yeah. Yes, it is very difficult. I will tell you that. I stayed at a hotel this weekend because I went to a conference. I went to an anti-aging conference. It was amazing. But I asked for my egg whites in the morning to be cooked not in oil. And they were like, well, then how are we going to cook them? And I was like, well, do you have, butter? I was trying to find out this poor guy on the phone was just like appalled that he couldn't cook my eggs in oil. And so anyways, it is a problem. I've never tried coconut oil. We'll have to try that, but we do cook in a lot of like tallow butter. So no seed oils. And I would agree, like it's just, it causes a lot of inflammation. And if you look at packaged things, right, they're always going to be seed oils in there. Palm oil, I think I see a lot. I'm trying to think of what are the other ones you see, but yeah, all of that is bad for you. 2 years.
Sure.
It can stay in your body up to 2 years. That's what you said?
Correct.
Okay. So no oils, no seed oils, people, none. Tell me about the keto diet as far as like some people swear that if you have seizures or you have issues with neurocognitive impairment, that the keto diet can cure that. Have you seen that? Is that something that we stay on forever? Do we just stay on it till symptoms get better? What are your thoughts?
So it was widely used for pediatric epilepsy, and it still is. So patients that have seizures that have been on multiple lines of medications, they eventually advise the family to put the child on a keto diet. So it does help with seizure prevention. It's used as a last resort for those patients because obviously they're kids. They want to have the cupcakes and the cakes or ice cream. And for them, limiting glucose and sticking to a keto diet is very difficult. But even for patients with cognitive impairment, it's shown benefit. So the biggest thing is limiting any type of sugars. And if you can decrease the starches, it's beneficial. But if you can stick with more of a keto diet for patients with cognitive impairment, they actually do better.
Okay. So then if you have cognitive impairment, keto diets do better. So would you be able to eat fruits and vegetables then if they're whole foods or no? As far as like,
So
what is your thought process with
I
that?
do a modified keto. So I say, look, stick with high protein, but for sure you need the fruits and vegetables as phytonutrients. But for me to make that decision, I definitely want to see their blood sugars, because if that's super elevated, then I'm going to tell them to cut down as many sugars or starches you can and stick with more of a keto plan first. And then eventually, once those inflammatory markers get normalized, then we can slowly introduce different foods.
Okay. I like that. So modified keto, meaning we can maybe have some fruits and vegetables, although we want to stick to stuff that's not super sugary. So in the fruit realm, that's usually just berries.
Correct.
And then in the vegetables, most vegetables I would say are not super sugary unless you're considering like sweet potatoes, things like that. In
But
the
not the broccoli and the
vegetable,
string beans and
yeah,
asparagus. Like those
right,
things are good for sure.
right. But then you're okay with all the fat with keto too? Like just eat all the fat? Are you somebody who's
No,
like, we
so
got
I'm lean and trim fat. Some people end up thinking that keto is automatically the worst type of bacon with tons of fat. For me, it's like
to,
lean steak, chicken, beef, turkey, duck, shrimp, like those type of lean meats, not bacon all the time.
yeah, and if you're gonna have
And
fat
keto
with
short term
keto,
is good.
yeah, and if you're gonna have fat with keto, you do good fats, right? So you do salmon, you do
Correct.
avocado, you do olive oil, do those type of fats,
Nuts.
maybe some butters. Well, how do you feel about like peanut butter? As long as it's like organic, just peanut, salt, water. How do you feel about nut
So
butters?
I would prefer almond butter more because peanuts are really legumes, and sometimes they can mess around with your levels of different hormones. So for me, a better non-inflammatory type of nut would be almond.
Okay,
And
hurting
then
my heart. I love peanut butter.
if you transition over to almond, I think you'll like it, especially if it's some vanilla in there.
Let's put some vanilla in there.
Correct, a little vanilla
Okay,
extract.
okay, I could try that.
But
Okay.
food is really the simplest and the most basic thing that people can do, right? It's I really believe in that cliche where food is medicine, because whatever you put into your body now, weeks to months down the line, you'll feel so different if you just make small changes. And it really affects how your genes react to your proteins in your body. You really can modify on how your epigenetics is taken into effect by just the food that you eat. So small changes, you'll notice quick
I
manifestations of it.
completely I completely agree. I tell my patients that all the time. Our GI tract regenerates itself about every 30 days, like completely. And so if you want to do something to make yourself feel better, you go from eating no crap to eating well. And in 30 days, you'll 100% feel better. And, I was in med school residency just like you. There was a time in my life I did not eat well. It wasn't like I was trying to eat terrible. It was just we were busy, right? And like,
You were up for
I,
30 hours straight. I mean,
oh,
that's what call was. It was terrible.
I was in that realm. You doctors in training now that get these work hour restrictions or whatever, good for you. But yes, we used to take 30+ hour call. You'd be awake. You'd really be there like 36 hours, right? Because you had to do the
Sign
after.
out
And
and the
yes. And
rounds.
then you're like, I'm getting McDonald's on the way home and I'm crashing.
Yeah.
But I will tell you, I've really, really tried the last, like, I would say 2 years to really just clean up my diet. And it's crazy how much different you feel. And every now and then, I'll go haywire for a day or we'll be on vacation or something and I'll eat things that I don't normally eat. Cause I'm like you, I'm sort of a creature of habit. Not exactly, but I have like probably 50 things that I eat. And if I venture outside of that, like for 2 days, I'm just like, my joints hurt. I don't feel good. My brain is just, it's crazy. what,
It's so how it affects us so quickly. And then people end up having leaky gut, brain fog, and then they
yeah.
think there's something else going on and they're having a headache. It's really simple as just making sure your food's controlled, simple and basic.
Yeah. And when you do actually eat good food, and maybe you can talk to this too, because people think I'm crazy, but when you actually do eat good food, you can eat a lot of it. Like I actually eat a lot of food.
Okay.
People are like, you don't eat that much food. I eat quite a bit of food, but it's whole nutritious food,
It's not
right? Like, I mean,
chemicals, right? Because those fancy chemicals are really breaking down your gut lining. You feel bloated afterward. You feel gassed. You just don't feel natural and right.
yeah.
What's your intake on dairy?
I personally don't do dairy. It bothers me, and I think it's inflammatory for a lot of people, especially women.
Yes.
You know, you can test for that, but I was having a lot of sinus issues. I was having some skin issues. And so I just stopped. Now I will eat lactose free Greek yogurt sometimes. So that
Okay.
doesn't necessarily bother me, but, or I'll just do like almond yogurt, some sort of, I love Greek yogurt though. I like the cultures I like, but I don't do any cheese. I haven't done cheese for over 2 years. I don't do butter unless it's tallow butter. And so I'm just me personally, I don't do dairy. It bothers me a lot. And honestly, I don't miss it at all.
Sure.
I used to think cheese
Not.
was a food group. I've had little bits of it since I stopped eating it, and it's almost like waxy and gross tasting now. Like it's just,
It's true. It's funny. Most people think it's a food group, but really, why do you need dairy if you think about it? You really don't, right? And when you think about the lobbyists who actually put that on the food chart and you look back where it came from, it makes no sense why there's dairy. Because if you're thinking about protein, there's better sources out there. Number one reason people think it's calcium, but there's better sources of calcium. And the way
like
we
what?
raise the
Tell
animals,
people what.
I think seeds are great. Sesame seeds, chia seeds, even the green leafy vegetables, even the great lean proteins have significant amount of minerals in there. So you don't really need cow milk. I mean, you shouldn't be drinking cow milk. If you think about the way they're raised, it's like in a factory where all the cows are there all the time. You know, it's funny. I saw something the other day in 2017. This blew up because a truck, I believe, was going through Wisconsin. It flipped over, and there was these red Skittles everywhere. And they finally asked the trucker where he was taking, and they figured out that they were feeding red Skittles to these cows to get them fattened up for the milk. So whatever the cow's eating, you're getting a byproduct of that.
Yeah. Ugh, yeah. You, the other thing, my deal with the dairy too is like to me, so if you think about it, we're the only mammals that drinks another mammal's secretions, right? And
Yes,
I
that's
mean, I
weird.
mean that secretions.
Yes,
And so as a child, do you need milk from your mom? Yes. But then as you get older, no. And like when you're drinking these animal secretions, I mean, your body's going to have a response to that, right? Like you're taking in an
yeah.
IgG that's not normal to human. Your body's going to be like, mm. And so it makes sense that you have this issue, but I agree, you don't need it for anything. You can get calcium and vitamin D from other places. I do like the yogurt aspect, but you, again, they make almond yogurt. They make lots of different types of yogurts. But yeah, it's, I don't have it. And I used to be that person who would come home and like just eat cheese for dinner, right? Like cheese and wine. That was like a staple for me. I don't miss it at all. I feel so much better. And I know people think that that's crazy and it's hard, but it's actually not this day and age. Like you can just not get cheese on lots of stuff. So it's really not that
Yeah,
bad.
you don't need to. And
Yeah, and the other thing is what they feed the cows, like you said. You know, a lot of the stuff they're feeding cows has a bunch of gluten in it, right? A lot of
correct,
pesticides. And so that was my next
herbicides.
question for you as well. Like, so I don't eat any gluten. I don't know how you feel about gluten, but that's also a no-go for me as far as brain health
I try to
goes.
stay away from it because you'll. I think most people thought it was a fad initially with the gluten-free diet, but I think you actually do better with it because it causes inflammation, right? Just like dairy does.
Yeah, for sure. And kind of in general, if you stay away from gluten, you're going to stay away from a lot of crap that you don't need, right? So if you're a person who identifies as I don't eat gluten, if you're at a restaurant or you're, you know, at a hotel or you're on vacation or whatever, 95% of the crap you shouldn't be eating, pastries, bread, all the stuff we're talking about anyways, has gluten in it. So it's real easy to be
Exactly.
like, identify as I don't eat that. And then you just move on,
Exactly. No,
right?
it's well said. So easy, so much easier when you put it that in that perspective.
Yeah. And that's kind of how I looked at it when I first started doing it. I didn't do it because I didn't feel well, but then it also just made it easier socially. And just for me, again, I try to make things very easy on myself. And I think sometimes you have to just like identify with, I'm just not a person that eats dairy and I'm not a person that eats gluten. So then whenever I go to restaurants with people and they put this amazing smelling bread on the table, it's really easy for me to be like, well, I'm not going to eat that because that's not my identity. I don't eat gluten. So it makes it
Exactly. And
easier.
you feel better. As soon as you have one piece or slice, you feel terrible afterward. You pay for it.
Feel awful. So you said that you're a pretty like creature of habit. So tell us like what is a day in the life of what Dr. Daniel eats?
So I do intermittent fasting. So I try to end my last meal at 8 p.m. or earlier if I can, depending on if I work out or not. So morning first meal I like to have around 11 a.m. and it's simple. It's the same ground beef or ground chicken I made with 2 eggs. So the way I break down my plate is a quarter of it's protein, a quarter of it's healthy fat with avocado, and half of it's like some kind of salad that I make. So my salads are not much of these. It's usually tomatoes, avocados, cucumbers, and olives. So that's my basic Mediterranean salad with 2 eggs and some kind of ground protein and a healthy fat like avocado. So that's lunch. And then I'll have a shake in between, like 2, 3 hours later, and then I'll have dinner. And if I feel like my protein content is less, then I'll have another shake at the end of the day. But for me, it's making sure I get 1 gram per body weight per pound of protein. That's kind of my go-to level, depending on how much I eat and what time.
So what's in your shake? What kind of shake do you have? This is intriguing.
Just basic clean protein and some water. And then the vitamins I take is I probably take 60 vitamins, 50 or 60 vitamins in the morning, and then I'll take another 20 at nighttime. But for me, it's some of the things are out there, and I like to take them because I see a difference. Like if I ever show you my old picture, I'll show it to you in person sometime. I was probably 225 pounds. Now I'm maybe 160. Super, super heavy set. Like post residency, post med school, I was super inflamed. If you look at my old pictures, I just look like a total different person.
You take 50 or 60 vitamins in the morning and 20 after that. Is that what you said?
Correct. Correct.
Thank you. So now I don't feel
It's
so crazy because I take like 40 and people look at me like I'm nuts. And I'm like, well,
it's not
so
for
you
everyone, I
have
think.
blown me out of the water. Okay, good.
I think Dave Asprey takes 110 or 100, some crazy number. It's like in a cup filled with vitamins. And I think for him, it's like taking 5 to 6 at a time, but I think it's a lot.
Yeah, that is there any vitamin or supplement? Are there like a top three that you think everyone should take?
Multivitamin for sure, vitamin D and omega. That's your basic. Things I like to add on top of that for brain health is really turmeric. I think turmeric has amazing benefits to it. I think that green tea extract is great. And sometimes I like to add something called alpha GPC, but I take that short term intermittently. So I cycle my vitamins. I try to take it Monday to Friday with Saturday, Sundays off. Or if I'm doing something that's unique or different, then I'll cycle it. Maybe I'll go on for 1 week, off for 1 week. So I have like a cycle where I go on and off.
I like that. I do that too sometimes. Sometimes on the weekend, I'm just like, no vitamins. I'm tired. Like
I feel the
tired of
same time. Like, I really
tired
don't
of
want to take these
taking
today.
vitamins. Yeah, no, but I do notice a difference when I take them. And then I'm a huge proponent of omega. Like I take a lot of omega. I can tell a difference personally. Um, okay, so you do salad, you do protein and healthy fats twice a day, and then maybe 2 shakes, and that's it.
That's it. But I'll get enough protein. My first meal will maybe have 50 grams of protein. My second meal will have 50 grams. And then the shake itself will probably have 30 each. So you're looking at
So
160, 170 grams of protein.
how are you getting 50 grams of protein? You're having eggs, and then you said turkey
A
or
protein
ground
source. So
beef.
it's turkey or ground beef. So the easiest way to calculate that is my ground beef would have, it's a hormone-free, antibiotic-free, pasture-raised, grass-fed. So it's very easy. On the back of it, it'll tell you that a packet has 100 grams of protein. So if I break that into quarters, where a quarter is each serving size, and I'll calculate how many eggs I need with that serving size to make sure it's about 50 grams of protein.
And then at night, you just do the same thing where you're eating like half of that amount of meat or double that amount
Correct.
of meat, I guess.
Correct.
Okay. Where do you get something like that? Grass fed, organic, free?
There are farms, regenerative farms online. Whole Foods, you have to really look at the packaging. You'll find some things there as well, but it's already closed off, packaged. It'll have hormone free, antibiotic free, grass-fed, free range.
Okay. What do you have any of these regenerative farms that you can go to online if people are curious?
So I've tried various ones. There's a Butcher Box is one of them. And for me, I'm trying to think of the other company that I use from Whole Foods. I can grab you the notes for show notes. I can grab you the name of it.
Okay. All right. Yeah, I like that. I eat a little bit more of a variety. I like fruits. So you don't ever have fruits. You're not a big fruit
Fruits I
person.
will. So fruits I'll eat at the end of my meal because if
Okay.
I invert it, believe my glucose will spike up. So if I'm still a little hungry or with the shake itself, I'll have some blueberries, which are great for brain health, but blueberries are great for nearly everything. So I'll do
Yep.
raspberry or blueberry. Sometimes I'll add watermelon slice as well, but it's usually after the shake or after a meal if I'm still hungry.
So what does it look like if you go out to eat, Dr. Daniel? Are you like, what are you eating when you go out? Do you just kind of eat whatever? Are you very picky? I'm just curious when you go to a restaurant, is there a way to eat better?
I think that it's a preconceived notion that you have to have an appetizer, the main course, and dessert. And I think that you automatically expect to eat that. If you think about when you go out and eat compared to going home or staying home and eating, you don't eat as much. You probably eat 2 to 3 times by going out, right? So you're actually binging and you're binging with things that are really low quality. So you feel terrible
Mhm.
afterward. So for me, I try to stick, if I'm going to do an appetizer, it's going to be more protein based, like chicken lettuce wraps. Like that's what I had the other day because it was light, it was easy. And then for the main course, I had some sushi, but I just kept it low volume sushi. Or if I go out and I want to have steak, then I'll make sure that instead of mashed potatoes, I'll ask them to do asparagus or string beans. So I improvise the starch with some kind of low glycemic food, an easy vegetable.
Do you ask them to not cook it in seed oil?
Most of them do not even know what that is. And it's very tough to find any type of meat that has those qualities that I tend to eat with home, like, right, hormone free, antibiotic free. It doesn't really exist. It's very hard to find that because most of the restaurants are being supplied by the same source, right? It's like the few 2 to 3 top companies that you see trucks everywhere supplying to restaurants. So their biggest incentive is, hey, let's increase the price at an expensive restaurant, make sure we have the biggest profit margin, but that profit margin doesn't come with quality. It's the same food you're going to get elsewhere without those great benefits.
Yeah, which is a problem in this country, right? It's all being, kind of like our drugs are, we teach everyone to give people drugs because that's what big pharma wants us to do instead of taking drugs away. And then our food industry is really sick too. It's sad, very sad.
It starts from, I would say it starts from pre-med and med school. Think about who sponsored all the lunches.
Oh, yeah.
They brought terrible food like pizza and cakes and
Yeah.
cookies. And they kept on giving us education on pharmaceuticals. There was rarely ever a topic of discussion on preventative health. It was mostly sick care. That's the only thing that they taught us during those
Yeah.
meetings. It was like, look, this
Yeah.
guy has this disease, this is a drug for it.
Yes, it's sick. That's what I say all the time. This country, we have sick care. It's a business. They want you to stay sick. I do not. I would love for you to be well and come and see me once a year. There are plenty of people I can help. I have people who tell me that or who make posts about like, well, you don't want people to be better because then you won't have a job. I 100% want you to be better. I promise I will always have a job. There is way too many sick people. I can't help them all. But I completely agree. And, to be completely honest, in med school residency, I believed that. I was on that bandwagon. Like I was like, yes, drugs are better because I was in the diabetes world. And so it's like we have all these great drugs, they'll make people better. And so I lived on that train for years. I actually helped pharmaceutical companies train doctors. Like I knew about Ozempic and I helped do the research with that. And, so GLP-1s and SGLT2s, I lived that for 5 years and put my patients on it and helped tell doctors about it. And then after 5 years, I was like, man, nobody is getting better and everyone is getting worse. And so I have come kind of full circle out of that realm, and I will tell you, when you stop writing all their drugs, they're not super happy with you. They don't come to your office and bring you as
No,
much food anymore, but I'm okay with that.
it works out better.
My staff sometimes are a little upset, but I'm like, oh, I'll buy you lunch. It's fine.
The stuff they
Um,
brought was crap anyway. It was terrible.
it
The stuff they
was,
brought was
although
insane.
the
They would
reps that
come to the office with cookies.
Yeah, no, it's true. Although the reps that come to my office now are very kind and they know like they don't bring crap. They know that they have to bring like good stuff. So we get Flower Child and stuff like that. But
It's funny. I used to
Okay,
have a rep
so
whose brother owned a blueberry farm, and he knew I would always turn away any type of dessert. So he actually would bring a whole box of blueberries from his brother's farm, which was pretty cool.
that's awesome. I would definitely, hey, any reps out there listening to this, I'll always take fresh picked blueberries. Okay, so we've lived the pillar of nutrition, which I think is very important for health. I think sleep is very important for health. So I want to quickly pick your brain on sleep and brain health. We can talk about exercise too if we have time, but so if you go on social media, this is the other thing that I hate. You have these people out there that have a million followers that, are killing in business or whatever. And they're telling people if you sleep more than 4 hours a night, you're weak and yada, yada, yada. So can you
So that's
give
terrible.
me your give me your input on sleep? Because I want to lose my mind when I see stuff like that. But
So I would say after food, or as equivalent to food, is sleep. It's really important for recovery, and that's how we recover our brain. It's actually called the lymphatic system. So they remind you of little street cleaning trucks in New York City. So when you're going to sleep, this lymphatic system becomes activated, where it takes away the toxins out of the brain to clean it out, right? So if your sleep quality is low, or you're not getting enough sleep, you're building up this accumulation of these toxins, which increases the risk for all neurological diseases, especially neurodegeneration. So sleep is important to heal the brain. It's what you're really doing. It's been there since the caveman era. That's why everybody goes to sleep. And if you look at that analogy, the problem these days is that our sleep quality is low because we're up late night, whether you're on social media, you're on your phone. It kind of disrupts that natural sleep rhythm pattern we have. We have to go to sleep at night and wake up early in the morning. We've disrupted that whole pattern. I mean, we're staying up all night watching social media, and the way these algorithms are made, you're actually hitting dopamine every time you hit a screen. So you're getting a reward system in your brain because it feels good every time you scroll up to the next video, and it's become an addiction. But sleep is especially critical for brain health for sure. What I usually recommend is shutting down any type of electronic probably 2 to 3 hours before bedtime. Other things I like to do myself personally is try to take a shower at nighttime, not too hot, not too cold, but lukewarm, to calm and rest the body down, the muscles down, and preparing the body to go to sleep. My usually habit is I'm out by 9. My wife always says I'm like an old person. I cannot go to dinner past, like dinner for me has to be 4 o'clock, because you want to give your body at least 2 to 3 hours rest before. You too?
same. I like dinner not past 5:30, 6 at the
No.
latest.
She's like,
Latest.
you're like the early bird special people that end up going there. I'm like, yeah, dude, I want to sleep good.
Yep. We could go to dinner together. Yep.
100%.
So you're
Um,
trying to, are you in bed by 9? What time are you in bed by?
9, and I usually have a sleep latency between 6 minutes and probably 12 minutes. I like to track my sleep score I use an Aura ring. I think that's easy for me to use. But the first thing I do every morning when I wake up is I want to see my sleep score and my readiness score every morning. That's becoming like addiction for me to see how I can even better my sleep.
Okay. So you're in bed by 9. And then what time do you wake up? Do you naturally wake up? Do you have an alarm?
I use an alarm, so about by 5:30. Somewhat naturally at the same cusp. I have to drop my little one off to school, but naturally wake up around like I would say like 5:30 ish, 6 ish. But I usually put alarm for 5:30.
Okay.
But
So that's 8 hours.
I forgot it's called like the hatch. So it automatically plays this rhythmic sound because I need a white noise machine at nighttime, and it actually lights up the room so you gradually wake up instead of just being jolted out.
It's called Hatch. Okay.
Yes,
Okay. But that's 8 hours of sleep. Yes. 9 to
it's pretty decent. Yeah.
5:30. Yeah.
Yeah.
And that's what you would recommend.
Yeah, I think that 7 to 8 hours is what you need, minimal of 7 hours. I would not do that 4 hour garbage that people say, because what you're doing is you're not resting your brain. Your sympathetic system is always in overdrive. So the nervous system, one way you can break it down is sympathetic and parasympathetic. So parasympathetic is rest and relax. Sympathetic system is flight and fight. So if a lion comes to the room, obviously my sympathetic system goes in overdrive. And if I want to relax, it's parasympathetic. So sleeping less really overdrives your sympathetic system, which then messes around with your cortisol, which helps you react to stress. And then eventually it increases your blood sugar, which then disrupts your hormones. So it's this cascade you throw off actually by sleeping a lot less because you're always in overdrive. I think the fact shows that if you sleep around 4 hours or less every night is as similar to driving as a drunk driver. because your reaction time slows down. It takes you longer to process things. Testing wise, it's classical. People that slept less for a test versus who slept adequate hours, the ones who slept adequate hours perform better physically and through any test taking.
Yeah, I wish I would have known this in medical school for sure, but I made it.
Oh, we were built. I mean, the whole system was a mess. You would do all night. I remember doing all nighters for 2 to 3 nights in a row.
Oh, yeah.
I barely ever
And then,
drank coffee, and it was a mess.
yeah, all night, go take tests. It's not smart. Yeah. Okay, so you're an 8 hour a night person. I agree. And I will tell you too, like there's lots of studies that show if you sleep less than 7 hours, it affects your insulin and cortisol. Like you said, that's what I tell my patients. You make worse food decisions. You're not nice. I am a huge exercise proponent, and I'm going to ask you about that in a second, but I will forego exercise to get enough sleep if I need to. Like if there is something that happened and I love to exercise and it kills me, but like if there's something that happens and I end up being up later than I want to, and it's going to affect me not getting at least 7 hours of sleep, then I will not exercise that morning, because I do think that sleep is even more important.
I do the same thing.
Yeah.
100%.
Now I will try to get in more
sympathetic.
Yeah, I'll try to get in more movement that day if I miss exercise or something, or I'll try to do it at night, but I am 100% going to get my sleep before my exercise. And that was never me before. I was like, nope, getting up, get my exercise. It doesn't matter. Yeah, I completely agree. And then how do you feel about go ahead.
After you guys.
No, go ahead.
It's not that you're getting older, you're getting wiser, because people are like, oh, you're getting older, that's why you feel it. It's not. It's because you're getting wiser and you really can judge little things you do to your body and how it takes the effect of it.
Yeah, as you get older and you listen to your body and you become more in tune with your body, and as you get well, right? So I had a lot of time in my life I was not well, but the more you get well, it's kind of like a positive mindset. The more positive mindset you have, or the more well you get, when things disrupt that, when negative people are in your life, or when you do things that don't make you feel well, it's like very glaring. And you're like, I don't want to do that. I don't like that.
Your tolerance goes down.
Your tolerance goes down. What about on the weekends? Do you keep the same routine on the weekends? Some people like to say, well, I burn the candle at both ends Monday through Thursday, but I sleep 12 hours a day on Saturday and Sunday. What is your thought process on that?
You never catch up. So even if you're disrupted Monday to Friday, there's no such thing as catching up, because you have issues still with your REM sleep that you need adequate every day. It's not a catch up with sleep, because you're still really destroying your body Monday to Friday. And then your catch up is your body's just burned out and you're forced to sleep.
Yeah, I like to tell people it's kind of like exercise. You can't go to the gym for 5 hours on Sunday and try to overwork a muscle because you didn't go all week. It doesn't work like that. It's about consistency.
It doesn't. Yeah. Consistent habits pays off 100%. It's a small task that you do every day that pays off in the long term, instead of major big hits that you take rarely.
Yeah. And that's why on the weekends, I try to keep the same sleep cycle. And when we travel, I try to keep the same sleep cycle. We travel to the West Coast a lot, and we'll be 2 hour time difference than what we normally are. And when we're on the West Coast, I keep the same time cycle. So I'll get up at 4 o'clock when we're there, and I'll be in bed by like 8 o'clock. I just try to keep the same, but I just kind of listen to my body. So good. So the recap from Dr. Daniel, the neurology guru, is that you must sleep, people. It must be at least 7 hours a night. You cannot catch up on the weekends, and you shouldn't change your sleep cycle on the weekends. So just pointing that out. And then, is there a time they should be in bed by? Because I believe there is. Some people say, well, I go to bed at 2 a.m., but I go to bed at 2 a.m., but I sleep till 10. Well, that messes up your growth factor and your cortisol, in my opinion. So is there a time we need to be in bed by, or you don't care?
For me, it's 9:30 works the best for me. I don't think that the 2 a.m. thing works. I think they're so stimulated beforehand that their cycle has been thrown off, and they kind of miss that sweet spot of when to go to sleep, because you'll notice their deep sleep is a lot less. The quality of the sleep goes down if you sleep later.
Yeah.
And it's all a rhythmic cycle, because before you wake up, you'll notice that there's a spike of cortisol because it prepares you for the day. There's a spike in body temperature. So the body is really a rhythm pattern. So you just have to find your best rhythm pattern. I don't think it's there at 2 a.m. I really believe it's more closer to 9:10.
Yeah, because your growth hormone cycles at night, as does cortisol. And so if you're up past midnight, you miss a lot of that natural growth hormone that we make, that you want to make, especially as adults. And so you miss that. And so that's what I tell people too, is like, man, when you're staying up till 2 a.m., it's doing a lot of things. But okay. So tell me briefly your thoughts on exercise. Does exercise help brain health? Does it not? Is it a bunch
Definitely.
of garbage? Do we
Such
run? Do we lift weights? What do we do?
Staying physically active is super important. It's shown that it makes more connections between nerve cells. So the theory before was for my stroke patients, once you had a stroke, you're done. It's not true. You actually can make new nerve connections based on exercise. Important exercise is dependent on your physical ability. So what I like to do is I like to do some kind of HIIT exercise. So I'll do two muscle groups, large muscle groups, but I'll do it antagonistically. So I'll do chest, back, but I don't take a break. I'll do it for 20 minutes straight. And then I'll do some kind of cardio afterward, which I hate, but I love at the same time as a Stairmaster because I can notice how high my heart rate can go up. And it uses a lot of your support muscle groups that you tend not to use when you're doing weightlifting. For brain health, there's many exercises that's shown benefit, especially in Parkinson's patients, when you use your visual cortex, when you're using your eyes to exercise. So now there's certain gyms for Parkinson's patients that do boxing. The other ones that use visual cortex, meaning sight and muscle and balance, is ping pong, tennis. So anything that's using a lot of sight with balance has been shown to be beneficial for brain health.
What
If
about
somebody's
pickleball?
older, pickleball, same thing. That's taken off everywhere.
Okay.
So I think it depends on the patient's level and ability, right? If there's somebody who's more frail, then I tell them, look, at least walk every day. I don't like using the marker of 10,000 steps, but walk as much as you can. And maybe you don't want to do it once. Maybe you want to do it a few times a day. Some of my patients who have cognitive impairment, who have difficulty walking and have diabetes, I tell them, look, walk after each meal, showing to decrease your glucose. And it's really great for brain health. Simple hack.
Yeah, that's my thing on the weekends when I have time. That's my favorite thing to do, is take my dog for a walk for 10 minutes after every time I eat. I think that's very helpful. So, yeah.
And
Okay.
flexibility. As people get older, they get a little bit more rigid. So yoga and any type of stretching is shown to be really beneficial. For
Yeah.
balance, I mean, many patients after the age of 60 or 70, one of the number one reasons they end up in the hospital is a fall and a fracture. So if you can build muscle, right, through resistance and help support your skeletal structures, but you're also flexible, one of your biggest risk factors goes down tremendously.
Yes, and I will tell you from research that if you are a postmenopausal woman and you get a fracture, that a quarter of you that have a fracture as a postmenopausal woman will die within a year. One quarter of women, because
Sorry to
they
hear.
end up, think about it, they end up with UTIs, they end up with pneumonia because they go to rehab, right? They break their hip gets pinned, they end up in rehab. They are already sick, they're already inflamed, they get a UTI, they get pneumonia, and they never leave rehab. It's a big
Oh
problem
yeah,
in
and then
this
they end up
country.
with the PE or DVT. Then they
Mm-hmm.
end up with another problem. Then they're on blood thinners for
Mm-hmm.
that. So it's a vicious cycle. One of
Yeah.
the things that I noticed you brought up fractures was that most people automatically assume calcium and magnesium with bones, but they forget that the number one structure in their bone is really collagen,
Yeah. That's
and,
true.
and it's insane. I was reading the other day that middle-aged adults who had a decreased protein intake had the highest risk for any type of all-cause mortality, whereas those who had adequate protein intake during mid-age had a better outcome.
Yeah. Interesting. Okay. So many great things, so many things I still want to ask you, but I know we got to wrap up. And I did like your point about social isolation too. So when we're walking, maybe thinking about taking somebody with us to walk, because I did see your post on Instagram about social isolation, and Instagram is almost the equivalent of smoking 15 cigarettes a day, which is insane. So you guys got to check out Dr. Daniel's Instagram. He puts some cool stuff on there, and maybe we'll be lucky enough to have him back at some point. We can ask him some more questions. But I have 3 questions that I ask every guest at the end of my podcast. So I'm going to ask you, what is the one food that's most beneficial that somebody could eat, and why, if you had to pick one food?
I love blueberries. I think that the benefits with the polyphenols super important for brain health. So
Okay.
blueberries, one food, okay.
Yeah. A lot of people say blueberries. A lot of people say eggs. Those are my top like foods. What is one easy health tip anyone can do? Maybe that's even free. What would you give the advice to somebody if they said, I just want to do something to be healthier? Maybe we're talking about brain health. What would you recommend that they could do that's maybe easy and free?
Free and easy, get out in the sun and start walking every morning. You're going to feel so much better. It's going to reset your whole lifestyle and mindset. Super easy to do.
Yep. I would say that's probably the number one answer. And then what is one thing you wish you would have known about your own health 10 years ago that you would have done differently?
If I noticed how easy it was to change by making small decisions every day and the payoff later on, I think that would be my number one, making an earlier change.
So what would you have done differently? Like what decision? Would have been in your diet? Would have been your sleep?
Diet, 100%. Eating healthier and sleep. I would say eating, food and sleep, back to the basics.
Yep. Food and sleep, back to the basics. I love it. Well, Dr. Joshua Daniel, thank you for coming on the podcast. I'm sure people are going to appreciate this. I do really like your content, though. It's good. It's very informative. I look forward to learning from you. I know that our guests love, information about brain health. And so I appreciate you coming on, and we will link all of his stuff in the show notes. So we'll link how you can find him on Instagram. And yeah, thanks for coming.
Thanks for having me. I'd love to do a part 2. It was awesome. So much more to talk about.
So much more. Okay. And if you guys liked this, please make sure that you share it with your friends and family. There's always people that you can share things with as far as improving their brain health. Make sure that you like and subscribe, leave us a review, and join us next Monday on Back to the Basics. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.